recording today's session. There we go. So welcome everyone. I'm Katie Wilde. I'm one of the co-directors for HDR UK Scotland alongside Kata and Hong Han. And today we are doing a joint webinar alongside colleagues from the Scottish Centre for Social Research. So we've got Paul and Vicky on the line with us today, and they're going to take you through a couple of presentations to give you an idea of what they've been doing. And then at the end of that, we'll open it up for questions. Feel free during the presentation, if you have questions as they pop in, to put them into the chat and we can pick up from there at the end, or you can save them to the end, whatever works for you. So just a little bit of information about it. I'm sure I'm going to maybe steal some of Paul and Victoria's slides, but we'll just do a quick introduction. So the Scottish Centre for Social Research, ScotCen, is an integral part of the National Centre for Social Research. It's based in Edinburgh, and the research helps government and charities in Scotland make the right decisions about the big issues. So they're going to talk to us today about a couple of projects. So I'm going to hand over to Paul first. Have I got that right?
Yep.
So welcome, Paul.
Thanks very much, Katie. Okay, so let me see if I can share my slides. Is that working?
Yep.
Great. Okay, so thanks very much, Katie. And yeah, great to be here. I'll let Vicky do her introductions later on. She's one of our research directors, and I'm the director of the Scottish Centre for Social Research, or ScotCen as we call it for short. I'm going to start just by giving a little bit of a background introduction to who we are at ScotCen and kind of what we do and why we're here. And then I'll go on to talk a little bit more about one of our projects that I guess I thought may be of specific interest to those of you who are connected with HDR UK. And then Vicky's going to go on to talk about one of our other projects in a similar vein. So I'll be talking about the Growing Up in Scotland study, and Vicky's going to be talking about the Scottish Health Survey. So yeah, as Katie said, ScotCen are an integral part of NatCen, or the National Centre for Social Research, and NatCen's a kind of unique entity in Britain. We're actually a not-for-profit organisation. We're registered as a charity, so we're effectively an independent research institute, and we've got a charitable purpose that is kind of formed around the idea that high-quality social research for policymakers can improve people's lives. So we sit sort of outside of academia, but we work very closely with academic researchers and a whole host of other collaborators and clients in the public sector primarily. So we're not part of the commercial sector, but we do operate as a sort of commercial business in some respects. But because we're a not-for-profit charitable trust, we can raise funds and bid for funding from research councils and foundations as well. So NatCen has existed since 1969. It was set up by two guys, Sir Roger Jowell and Gerard Toynbee, who were really passionate about social research and surveys in particular. And their vision was for this independent organisation which could design and carry out and interpret rigorous studies within the field of social and public policy. So we're what you would call a full service research agency. So we can largely do everything from designing and developing research projects, collecting and analysing the data, writing the reports, presenting the evidence to stakeholders, and that's across survey, so quantitative research and qualitative and mixed mode research. And there's been an office, a NatCen office in Scotland since 1999, and we officially adopted the name the Scottish Centre for Social Research, or ScotCen, in 2005. And so although we're based in Edinburgh, and we've got about 20 staff based out of the Edinburgh office. We can utilise all of NatCen's resources, including a full UK GB-wide interviewer panel for conducting in-home kind of face-to-face CAPI interviews. So what areas are we working in terms of policy? Well, this slide sort of broadly attempts to summarise the key kind of policy themes or substantive areas of research that we are working in. And I guess the circles are a fairly unscientific way of me trying to represent the proportion of our work that falls into each of these sort of domains. So we do lots of work in the public health arena, and particularly in relation to health behaviours, especially smoking and alcohol, but also diet and drugs to some extent as well. And we do a lot of work in the mental health area of public health too, as well as wider kind of public health research, and Vicky will touch on that, the Scottish Health Survey being one of our key projects in that area. Aside from that, quite a range of work related to children and families, and some of that sort of linked into different parts of the education system, whether that be from early years learning, early learning and education through primary and secondary school, and more recently into further and higher education and those post-school transitions. We do a range of work in social political attitudes, in particular our social attitude survey, but we work very closely with Sir John Curtis, who is a senior research fellow for NatCen, so works with us a few days a week to work on both Scottish social attitudes and British social attitudes and a range of linked attitudinal projects. And then a smattering of work related to crime and justice and gambling, and a host of other smaller policy areas too. Our clients and funders are pretty broad ranging. I mean, our primary client is the Scottish Government, so we undertake primarily commissioned work for them that we bid for on a competitive basis. And similarly with other public sector agencies, we're bidding for commissioned work routinely, but also undertaking a range of grant-funded work, whether that be from ESRC. We've got a big NIHR funded project at the moment, some CSO funded work as well. And across all of these projects with these different funders and clients, working with a range of partners and collaborators as well, particularly in the academic sphere. So you can see from the slide there a whole host of academic partners, particularly in Scotland, but also further afield, working with Swansea and UCL at the moment on a few projects in Bristol too. What about the actual projects themselves? Well, this next slide gives a sense of what are our standalone random probability survey projects. So these aren't the only surveys that we do, and nor are they necessarily the most complex, but many of the other surveys that we conduct are part of wider mixed method projects. So these are really standalone survey projects that are put up here. And each of these four also have traditionally involved face-to-face data collection, where we utilise our field panel of trained survey interviewers. Although I'd say Scottish Social Attitudes now has moved to a web completion approach. And in fact, all of the surveys on this slide have used some form of web or remote data collection, particularly over the COVID period when in-home data collection wasn't permitted. And what we've got here are two of the Scottish Government's core household surveys, so the Health Survey and the Crime Survey, along with the Scottish Household Survey are the three core household surveys. The Health Survey you'll hear a bit about later. The Crime and Justice Survey we deliver in collaboration with Ipsos, and it's Ipsos who do the Household Survey. And as I say, some ad hoc surveys aside from this, most notably in recent years, the Lothian Health Survey and the Maternal and Infant Nutrition Survey. In terms of other work, here's just a kind of example of a range of projects that we've conducted that we're currently in progress with, actually, or we've completed over the last probably 2 years. So you see in the green area at the top, some of our qualitative and mixed method or evaluation projects in the public health sphere, so particularly that new nicotine projects, as we call it in the office, vapes in schools, is exploring use of some of these new e-cigarette and vaping products amongst secondary school kids. We've done some work for Public Health Scotland measuring issues related to perinatal and infant mental health, so research with mothers and health practitioners, and some mental health intervention evaluations as well. And then in the kind of children and families and education sphere, a big study on the expansion of early learning and childcare, and another smaller related study associated with that as well. We've been doing a range of work over the last kind of 5 to 6 years on the devolution of welfare in Scotland and evaluation of some of the initial Scottish benefit payments, particularly those which have been made to families. And then some of that education work at the bottom there as well, the student finance and wellbeing study and the behaviour in Scottish schools studies. So as you can see, quite a multidisciplinary team of researchers working quite dynamically across different methods and different topic and policy areas. That's all I wanted to say just now about ScotCen generally. So I was going to move on and just keep going to talk about the Growing Up in Scotland study now. So Growing Up in Scotland, one of our largest and longest standing projects that ScotCen have been delivering since 2005. In fact, a little before that, 2005 was when the data collection launched, but we've actually been working towards the launch of the study for a couple of years prior to that. But what is the Growing Up in Scotland study? So it's a large-scale longitudinal birth and child cohort study involving national samples of children living in Scotland. It's had 3 cohorts of children involved to date. So when we launched the data collection back in 2005, we had 2 cohorts that we called Birth Cohort 1, so just over 5,000 children born in 2004 and 2005 who were aged around 10.5 months, and then a slightly older cohort of just under 3,000 children who were aged just under 3 in 2005. And then latterly in 2011, a second birth cohort that we called Birth Cohort 2, a little bit bigger, just over 6,000 children, all born in 2010-11, and again aged around 10.5 months at that first interview. And these numbers in the birth cohorts in particular, if you know a little about demographics in Scotland, there are about 50,000 children born every year. So those birth cohorts sampling about 1 in 10 children nationally across the country. So quite a sizable representation of all children born in those periods. This is a Scottish Government commissioned study commissioned out of the Children and Families Analysis Division, part of the Education Directorate, and we've been running continuously largely since 2005. So what is the purpose? What is the Growing Up in Scotland trying to achieve? Well, this slide sort of summarises some of the primary objectives and domains of interest. And in many ways, GUS looks like an academic-led, grant-funded cohort study, much like the British birth cohort studies that you might have heard of. But contractually, it's a government-commissioned project, similar to most of the work that ScotCen delivers. But I think on this project, ScotCen have adopted a bit of a co-principal investigator role, if you like, working alongside and very closely with Scottish Government to advise and direct the strategic aims and the scientific content and methodological design of the study. And this has resulted in a role for us that has reached far beyond the day-to-day delivery of the various survey sweeps. So our delivery of GUS has not just been about designing a questionnaire and collecting the data, but really setting up a data infrastructure to support longitudinal research on children and families, childhood, adolescence in Scotland, and trying to promote that really rich resource and encourage people to use it. So here you can see the sort of kind of key domains where we've captured data, and I'll say a little bit more about in detail about the nature of the data that we've got on GUS in a minute or two. So it's pretty much a multidisciplinary study, and it attempts to allow the investigation and analysis of children's outcomes across a range of domains, building in multiple sources of risk factors at different levels of children's lives. We collected quite a lot of data on the study, as you can see. So this slide summarises for each cohort at which age points we've collected data and where in terms of the calendar year those data collection fell. So what you'll notice immediately is that the most comprehensive data collection has been with birth cohort 1, and in fact neither the child cohort or the birth cohort 2 are active anymore, and I'll say a little bit more about that later if there's time. But so what we've got are 12 sweeps, as we call them, of data collection for birth cohort 1, covering the period from birth through to age 20, and we're currently in field with that kind of age 19-20 sweep and actively collecting data right at this minute. So a really detailed picture and trajectory of children's lives over those first 20 years. The sources of data in the study have been quite varied. So of course it is centred around an in-home data collection exercise, which is conducted using computer-assisted personal interviewing. So we send an interviewer out to the household, and they have largely, since birth, been interviewing the child's main carer, and that's predominantly been the child's biological mother, although not exclusively. And you can see that main carer has participated in that way at every sweep up until this 20-year sweep. We've also collected data from partners of the main carers, from the child's teacher, and of course from the cohort members, the children and young people themselves from age 8. Aside from those survey questionnaires, we've got objective measurements, so height and weight, cognitive assessments, and then aside from all of that survey element, that in-home data collection element, largely, the linked administrative data that we've facilitated alongside the survey data. So we've got some health admin data that I'll say a bit more about later, some school and education data, and we're in the process of getting some attainment and post-school destinations data. And this next slide then summarises, it takes a little bit further some of those primary objectives and domains of interest that I showed earlier, to summarise the wide-ranging topic content of GUS. So it's not unlike many other multidisciplinary cohorts, which are informed by a social science approach. And what this means is that GUS is the data it's got the potential to inform evidence-based policy making in a wide range of domains. And that's quite a positive position to be in, because it maximises that return to Scottish Government from what's a fairly significant research investment. Over these next couple of slides, I've just tried to focus in and highlight some of the topics that I thought might be of particular interest to those working in the health research sphere specifically. So starting here with data that's been provided by the cohort children themselves, you can see that we've got some relevant data from age 8 onwards, particularly on mental health and life satisfaction. And then we get more comprehensive data as the children got a little bit older, and we could ask them slightly longer and more complex questionnaires from about 12, 13. And from that point, we've got a range of repeat measures on several topics, including health behaviours, mental health, body satisfaction, and then various sort of age-specific or ad hoc measures dropped in at different age points. So measures of puberty or diet, a couple of examples of that there. And then, of course, we've also got data on the child that's been provided by the parent. And this covers some similar, but also some additional topics, as you can see from the slide. So we've got things like physical activity, sedentary activity, food and eating, sleep, general health, including accidents and injuries, and then some additional mental health and well-being and social, emotional and behavioural developmental measures as well. So aside from that data from the children themselves, this other rich set of data that parents have provided about the children's health and the health-related outcomes. Then, of course, we've asked the parent themselves a range of questions about their health, also about a whole host of other topics and issues. But this slide here summarises some of the key health topics that we've asked our GUS parents about over the years. So again, general health, pregnancy and birth, physical and mental health and well-being, a little bit about their physical and sedentary activity, but also some questions on adverse childhood experiences, and of course, health behaviours feature in there too. I mentioned earlier we've got some objective data. Part of that objective data is on the child's height and weight, and these are measured in-home by our survey interviewers who we train to use scales and stadiometers for this purpose. So some neat trajectory information on the children here, starting from age 4 and covering right up to age 17. At pretty much every point we collected data from them. And we also captured the child's mother when the child was age 6. And we use these measurements to pre-calculate a range of BMI measures which are included in the data sets alongside the raw height and weight data. And you can check out a large number of publications which have used these data from the study website. We also have collected, in collaboration with the MRC CSO Social and Public Health Sciences Unit, some objective physical activity data, initially at age 10, where we invited a subsample of GUS children to take part in this follow-up exercise, where they were asked to wear activity monitors and GPS devices for 8 days. And there were about 800 participants took part in that, and some of the derived measures from that age 10 data collection have now been made available via the UK Data Service alongside the main survey data. A repeat exercise was undertaken at sweep 11, so age 17, 18, but that data is still being processed by the Glasgow team, but we would hope to make it available to others in due course. Then the linked health data, and I think I saw a little question about that. Yeah, so the GUS cohorts, all the GUS cohorts are chi-seeded, so in principle, it's feasible to connect our survey data and the children in the cohort with any Scottish Health Administrative data that's held by CHI. When we initially set up this linkage, there was a move to set up a sort of minimum linked data set that would sit there and be more easily accessible. And that linked data set included variables from each of the data sets, the admin data sets that are shown on the slide here. So everything from hospital attendance and admission through to dental health. And actually, there's been some recent publications from a team in the dental school at Glasgow who've been analysing some of the Child Smile data that we've got linked to the GUS survey data set. So lots of rich potential there through that linkage alongside these kind of additional background variables and considerable explanatory variables that we've got in the survey data set itself. How do I access this data, I hear you cry, perhaps? Well, all of the survey data is deposited at the UK Data Archive or UK Data Service. So that's 11 sweeps for the birth cohort and each of the child cohort and birth cohort 2 data sets. They're free to access for all bona fide researchers through a special license application. So that is a short application where you have to set out briefly how you're intending to use the data, how you'll store it, and that gets approved by the project lead at Scottish Government. And then you can download the data locally to analyse. There are some more secure data sets held on the UK Data Service as well, specifically geography variables. So we've got for each sweep the data zone of the child's home address, their intermediate geography, local authority. You can get Health Board on there as well. We've got a range of Care Inspectorate administrative data, so it's specifically the scores from inspection ratings of the nursery that the children in birth cohort 1 and birth cohort 2 attended. And then the age 10 objective physical activity data is on the UK Data Service as well. To access the linked health administrative data, well, actually, GUS survey data has just recently been included in the Research Data Scotland or ADRS catalogue. So if you're intending to use the survey data linked to health administrative data or indeed education administrative data, then that application is made via Research Data Scotland and ultimately IDRIS and goes via the Health and Social Care Public Benefit and Privacy Panel. And, you know, all the additional requirements for researchers accessing those sorts of data are required to access this. And you can get some information on that now via the Research Data Scotland metadata catalogue if you look up Growing Up in Scotland on there. If you're just looking for the survey data itself, you can apply via the UK Data Service. There's a whole page on accessing and using the GUS data on the project website. I put a link up there, but if you just stick Growing Up in Scotland in Google, it will take you to that. And that includes all the data documentation, so you can see all the variable lists, all the questionnaires. You can access user guides that tell you more about sampling and weighting, give you overview of the topics, as well as linking you direct to the study pages on the UK Data Service. And just to finish off my little bit, a couple of little examples of where the data has been used specifically to do, you know, some fairly notable health-related research. So this particular first example, a piece of work that we did with the Data for Children Collaborative at University of Edinburgh, working with John Frank and colleagues there to look at the ability to use routine data to predict childhood obesity at age 12. A really interesting paper. You can get a link to that on the GUS website. And the SPACES study, which is the physical activity study that we've been collaborating with at University of Glasgow, got a whole host of papers where they've utilised that objective physical activity and GPS data to look at a range of factors associated with children's health outcomes. And that is all I wanted to say about GUS and ScotCen today. Thanks very much. I'll stop sharing.
One of the questions that has come in from Stephen is, and you might need to go away and think about this, Paul, but we'll give you a heads up, was whether you know roughly how many NHS Lothian births will be captured between your 3 cohorts.
Yeah, I think I was trying to, because we have looked at this before, although I haven't looked at the numbers for a while. I think across the 3 cohorts, it's probably somewhere, and I'm going to choose a really broad range there. It's somewhere between, it'll be somewhere between 500 and 1,000. It might even be a bit more, but actually I can do, while Vicky's speaking, I'll have a wee look and I'll get the answer.
Great, Thank you very much, Paul. And we're going to hand over to Vicky now to keep us intrigued with the next project.
Thank you very much, everyone, for taking the time to listen to a short presentation about the Scottish Health Survey. If we could go on to the next slide, please. So I have split this into roughly two sections. So one is what's called measuring population health and well-being. So that's going over a brief overview of the Scottish Health Survey, and it will be a brief overview because it is a big survey that's long running, but there are links at the end for more detail if you need it. And then I'm going to look at, or going to share some examples of the Scottish Health Survey, or SHARES as we'll call it for short, some of the impact that it's had and some of the ways that the survey has been used. If I could have the next slide, please. So SHARES is a national survey about the health and lifestyles of people in Scotland. It was first commissioned in 1995 and has been conducted annually since 2008. So that's quite a wealth of data and a large time series of data that's now available through SHARES. It's commissioned by the Scottish Government, and it's used obviously by the Scottish Government a lot, but also other interested parties to do a few different things. So one of them is to estimate the prevalence of health conditions. So cardiovascular disease, for example, has long been a focus of SHARES, but there's also things in there now like mental health conditions, long COVID over recent years, you know, a lot of different health conditions as part of the survey. It also allows analysis of the prevalence of particular risk factors. So we measure a lot of health behaviors like smoking, alcohol, physical activity or inactivity, and all of those can be used to analyze alongside the data and look at health risk. The data makes it possible to compare regions and subgroups, so it's not just at the national level. So we can look at local authorities, for example, or we do a fair bit of analysis by area deprivation and looking at any differences in the data that way. And as I mentioned, there's quite a significant time series now. So that allows us to look at this data across certainly for questions that have been in for a while across several years, and to be able to see how things are moving and changing, or in some cases not changing. SHARES is an accredited official statistics survey, so that means that we have to abide by the processes and the way that data is collected and treated in the Code of Practice for Statistics as well, and it also gives the survey that extra sort of badge of authenticity, if you like, or you know, badge of kind of the standard at which the survey is run. If we could go to the next slide, please. So in terms of who we speak to as part of SHARES, it is a random sample, so it's designed to be representative of the population of Scotland who live in private households. In most cases, we can interview everybody in the household, so we have a core sample, and I'll go into a bit more what that means shortly, but a core sample where we interview up to 10 adults and up to 2 children in the household. I don't think we get many households with 10 adults in them, but I think if an interviewer got one, they'd probably think they'd struck gold because, you know, if they got all those interviews in one household, that would be fantastic. And we also have a child boost where we interview up to 2 children only, and that's because we don't get sufficient child interviews from the core sample to be able to do the sub-analysis that we want to do. We don't accept proxy interviews for adults or for children aged 13 to 15 because they can answer the questions themselves with an adult present. So if somebody isn't willing or isn't capable of answering the questions themselves, they don't take part in the survey. Okay, if we could go to the next one, please. Yeah, so what I've done here is try to illustrate how it works for an adult interview and then child on the next, although we do child interviews as part of the core samples. So for adults, we have our core sample split into core version A, which is around about 2/3 of the sample, and core version B. And they have a lot of similarities. So for both samples, we do a household questionnaire. So that gathers information on the household from one person living in the household. And then we have individual sessions for up to 10 adults. we can interview 4 adults at a time. And what we do is we go through core modules that apply to both versions of the survey. We have some rotating modules, so they might be filtered by age or just asked of version A respondents, for example. We have self-completion questionnaires that are completed, and we also take height and weight measurements. So as Paul was referring to earlier, they're sort of objective measures. The difference for the core version B is that they tend to have a slightly shorter interview, but we invite them to take part in additional measurements, adults only. So we ask if they would be willing to have their blood pressure taken, waist circumference measured, and take saliva samples, and that is to test for cotinine and anabasine, to look at things like nicotine levels and whether that's come from passive smoking or not. Also in the version B, we have some additional questions on anxiety, depression, suicide and self-harm that aren't part of the questionnaires asked of version A. If we could move to the next slide, please. So the child sample, the main difference for the children, it isn't in what they're asked or what is part of the interview. It's just whether they've come from the core sample or a child boost. So the child boost, as I mentioned, is to give us additional child interviews, and we get that sample by linking to the CHI index, Community Health Index, to make sure, well, to try and visit more households with children in them. And they get the same kind of interview flow as everybody else. Sorry, I'm just aware of time, so I'm going to go through these quite quickly. Next slide, please. So as it says on this slide, there is that wealth of data across the time series, and we have the core modules. So those are the ones that are asked of everybody and that are included each year. So they include things like general health, long-term illnesses, cardiovascular disease, but also things like the health behaviours I mentioned earlier, mental well-being measures, and also in recent years, things like food insecurity that help to look at, things like the impact of the cost of living crisis on various, health outcomes. Next slide, please. We also enhance this with rotating modules, because otherwise the survey would be absolutely massive. So those include things like stress at work, unintentional injuries or accidents, as it was previously referred to. And then within the self-completions, we have things like adverse childhood experiences in some of the surveys, but we've also in 2024 collected brand new data for shares on eating disorders. So there's a scale, a bank of questions people ask, and also perimenopause and menopause, which is the first time that's been covered in the survey. Next slide, please. So in terms of how the shares data is made available, there's a report published every year, and this year for 2024, we're planning chapters on things like general health, physical activity, but also the perimenopause and menopause data that we haven't had in previously. And within diet, we'll be publishing data using Intake 24. And alongside that, we have the tables for each chapter, a summary, a technical report, and the data is also archived on the UK data service. So presently that's up to 2022. There's also a data dashboard that the Scottish Government maintain. So when the 2024 report is published in September of this year, there will be around 100 indicators on there, and they can be analysed across time, but also by subgroups such as local authority. And you can see how your local authority fits in with others on a range of different measures. If we could go to the next slide, please. The other thing on data analysis is that we now have survey data, that should say between 1998 and 2020, linked to various administrative data on health. So hospital visits, diagnoses and treatments, COVID-19 results, etc. And that can be accessed by first contacting Public Health Scotland, explaining the nature of the research, and then there's an application process to go through to access that data. Okay, next slide, please. I'm just going to go through these fairly quickly, but I am, happy to be contacted if there's any further questions. So next one, please. So I've got a couple of initial examples of use of shares by the Scottish Government and the impact that it's had. So one of the areas is around looking at parental well-being. And this was part of the Children, Young People and Families Wellbeing Outcomes Framework, which rolls off the tongue. The idea with that was to investigate potential indicators on parental well-being and to look at how that could be measured and monitored going forwards. And the value of shares to this was to help with better understanding of the links between things such as well-being and poverty, and how policies might be able to interact with that and how it may be able to look at improving that in the future. If I could have the next one, please. So yeah, and the other thing that shares has been used for is informing plans for a legal entitlement to break for unpaid carers. So we collect data on unpaid caring within the survey as part of the core modules. So shares data was used to look at the prevalence of carers to estimate the level within the population, the number of people who are unpaid carers, and to cost those to cost that up. In terms of being able to offer that, and that is legislation that is going through Parliament, which is really lovely to see the data used in that way. So yes, last slide, please. Thank you. This is finally just a few recent users of the shares data. So their analysis has been done using mental health measures, so looking at that over time, you know, pulling out things like poor mental health among working age adults, looking at the potential protective effect of physical activity. There's also been some investigation around self-reported general health among smokers and e-cig users, which I would caveat with the fact that more research is needed on the long-term impacts of e-cigarettes. It's been used extensively to monitor the minimum unit pricing on alcohol in Scotland, and also by Paths for All to look at, to visualise the data, but also look at the provision of walking and paths for everyone. So that's everything I had to cover. If you could go to the next slide, please, just to say that there are links here for more information. I know there's been some put in the chat as well, but just for the recording, if anybody wanted to screenshot it. There. So that is a very whistle-stop tour of shares, but hopefully that's been informative. I think I saw a couple of questions pop up, but I'm assuming somebody's
I'm going to come in. So thank you very much. So firstly, thank you, Paul and Vicky, for that. I think that's really interesting, and it's really good to hear what else is out there and that it could be linked to health data quite easily. So there are a few questions in the chat. So we'll go with one from David first, which was, does shares cover the staying in care homes?
It doesn't, no. It's only private households, unfortunately. I think some of the logistics and ethics of certain, certain locations, unfortunately, means we can't cover them, no.
Okay, so yeah, I think then for David's second question, the answer is that there's no questions on like paid or formal care or anything like that within shares.
I mean, we have questions on employment. So if somebody is working in care, that would come through in that section, but we don't ask any questions. We ask the same employment questions, whatever the job is. We don't have a specific section on paid caring, no.
Yeah, okay, perfect. Okay, so another question for you. So this is around your saliva samples. Do you have the samples for all members in the household, including children? And then Matthew wants to test your brain to ask you how many samples you have collected and whether they are available for genotyping.
So we collect samples only from adults in version B households who consent. So obviously we get a little bit of a drop off. We get more people giving blood pressure than waist circumference than saliva samples. So that answers, yeah, the first part of the question. The second one, in terms of numbers, I couldn't tell you overall, but I can tell you it's usually sort of between 900 and 1,000, I think, per year. Unfortunately, we have a consent form and the participants consent to particular uses of their data. So I don't think under that we could make samples available for particular research, but it might be something the Scottish Government would be willing to consider for future surveys, you know, if we were able to gather consent to do that.
Well, those are all the questions in the chat. So I'm going to open it up to people online if you want to put your hands up or add any more questions in to ask Paul and Victoria any questions on what they've presented today. And whilst they're thinking about that, Paul, I was going to ask you a question. I know that you said that we've got Kai and you've linked it to some data, but if you could link it to any healthcare data, do you have a preference of which one you would like it linked to? Is there a data set there that you would like to link?
I mean, I don't think I have a strong. I mean, the potential is there to because we've got the Kai seed to link it to any data set. What's been done so far is a little on some health visitor, child health surveillance, and some dental health. I mean, I think there's some really rich potential in the hospital admission data, but there's, you know, the prescription data now that's available as well. I think really fascinating to see, you know, how that's associated with children's outcomes at school, different behavioural, social, emotional behavioural reports that we've got in the survey data as well, could be looked at in relation to some of these prescription medication that kids have been on over time.
Yeah. And I think also now that we've got the UPRN in some of these data sets as well, actually getting that household measure as well for people and the various things would be really useful. Okay, we have got a question that's come in. So this is from Eleanor. And it's asking about the participants in GUS or shares. Do they ask how their data is being used in research and how it's been used to inform policy, particularly those that have been in the 11 GUS sweeps?
Yeah, I mean, and hi, Eleanor, by the way. They don't need to ask because we tell them. And that's a big part of what we do, certainly. I mean, GUS, it's a major tool for our interviewers and engaging people with the study and convincing them to continue to take part. So we make a special effort. So on GUS, we have routine participant newsletters, and a large part of those newsletters is about saying, you know, one, thanks very much for being part of the study, and two, look at some of the recent findings. Three, here's how these findings are contributing to some significant policy making. And it's not always easy to make a direct link, but yeah, we're certainly doing that routinely. And yeah, Vicky will be the same. It's slightly different on shares, but
yeah, so it's the same in that we provide in the participant materials information on what happens with data. So there's an information leaflet that's given at the time of interview. Obviously, we're speaking to different households each survey, so we don't have regular communication with them, but we do provide the information and the opportunity within the survey to opt out if they wish to do so, which I'd say about 80% of the sample, you know, don't opt out. So sorry, I should phrase that better. 20% of the sample roughly would opt out of the data linkage.
Okay, right. No, we don't have any more questions. That was Serena. So unless we have any final questions, we are coming up to 5 to the hour. So we will give people 5 minutes to have a quick drink before their next meeting. But it leaves me to say a big thank you to Paul and Vicky for coming along today. Hopefully you found it really interesting. We've put some links in the chat for you to go find some more information and we'll provide the slides afterwards. We will now be back in September with the Smart Data Foundry. So we'll have an event coming up. If you want to know when that is happening, make sure that you're signed up to our newsletter. You can just email us with the email address that Serena's popped in, and we'll get you on the mailing list so you know when these things are happening. But thank you very much to everyone for attending. Thank you to Rachel for keeping us all in check. Thank you very much, everyone, and we will see you soon. Thank you.
great.
Thank you. Bye.
Cheers. Bye.